So I want to show you some cognitive illusion or decision-making illusion in the same way. This is one of my favorite plots in social sciences. It's from a paper by Johnson and Goldstein, and it basically shows the percentage of people who indicate that they would be interested in giving their organs to donation. And these are different countries in Europe, and you basically see two types of countries. Countries on the right that seems to be giving a lot, and countries on the left that seems to be giving very little or much less. The question is why? Why do some countries give a lot and some countries give a little? When you ask people this question, they usually think that it has to be something about culture, right? How much do you care about people? Giving your organs to somebody else is probably about how much you care about society, how linked you are. Or maybe it is about religion. But if you look at this plot, you could see that countries that we think about as very similar actually exhibit very different behavior. For example, Sweden is all the way on the right, and Denmark, that we think is culturally very similar, is all the way on the left. Germany is on the left, and Austria is on the right. The Netherlands is on the left, and Belgium is on the right. And how are they doing? Turns out the secret has to do with the form at the DMV. And here's the story. The countries on the left have a form at the DMV that looks something like this. Check the box below if you want to participate in the organ donor program. And what happens? People don't check and they don't join. The countries on the right, the ones that give a lot, have a slightly different form. It says check the box below if you don't want to participate. Interestingly enough, when people get this, they again don't check, but now they join the program. Now, think about what this means. We wake up in the morning and we feel we make decisions. We wake up in the morning and we open the closet and we feel that we decide what to wear, and we open the refrigerator and we feel that we decide what to eat. And what this is actually saying that much of these decisions are not residing within us. They're residing by the person who's designing that form. When you walk into the DMV, the person who designed the form will have a huge influence on what you'll end up doing. Now, it's also very hard to intuit these results. Think about it for yourself. How many of you believe that if you went to renew your license tomorrow and you went to the DMV and you would encounter one of these forms, that would actually change your own behavior? Very, very hard to think that it will influence us, right? We can say, oh, these funny Europeans, of course it would influence them. But when it comes to us, we have such a feeling that we're at the driver's seat. We have such a feeling that we're in control and we are making the decision that it's very hard to even accept the idea that we actually have an illusion of making a decision rather than actual decision. Now, you might say, these are decisions we don't care about. In fact, by definition, these are decisions about something that will happen to us after we die. How could we care about something less than something that happens after we die? So a standard economist, somebody who believes in rationality, would say, the cost of lifting the pencil and marking a V is higher than the possible benefit of the decision, so that's why we get this effect. But in fact, it's not because it's easy, it's not because it's trivial, it's not because we don't care, it's the opposite. It's because we care, it's difficult, and it's complex, and it's so complex that we don't know what to do. And because we have no idea what to do, we just pick whatever it was that was chosen for us. I'll give you one more example for this. This is from a paper by Redelmeier and Shafir. And they said, would this effect also happens to experts? People who are well paid, experts in their decisions, do it a lot. And they basically took a group of physicians. And they presented to them a case study of a patient. And they said, here's a patient, he's a 67-year-old farmer, he's been suffering from a right hip pain for a while. And then they said to the physician, yes, you decided a few weeks ago that nothing is working for this patient. All these medications, nothing seems to be working, so you refer the patient to hip replacement therapy, hip replacement, okay? So the patient is on a path to have his hip replaced. And then they said, half the physician, they said, yesterday, you reviewed the patient's case and you realized that you forgot to try one medication. You did not try ibuprofen. What do? Do you pull the patient back and try ibuprofen, or do you let them go and have hip replacement? Well, the good news is that most physicians in this case decided to pull the patient and try ibuprofen. Very good for the physicians. The other group of the physicians, they said, yesterday when you reviewed the case, you discovered there were two medications you didn't try out yet, ibuprofen and piroxicam. They said, your two medications didn't try out yet, what do? You let them go, or you pull them back. And if you pull them back, you try ibuprofen or piroxicam. Which one? Now, think of it. This decision makes it as easy to let the patient continue with hip replacement, but pulling them back all of a sudden becomes more complex. There's one more decision. What happens now? Majority of the physicians now choose to let the patient go to hip replacement. I hope this worries you, by the way, when you go to see your physician. The thing is that no physician would ever say, piroxicam, ibuprofen, hip replacement, let's go for hip replacement. But the moment you set this as the default, it has a huge power on whatever people end up doing.